Good evening, guys. Give me a minute. I have discussion D for you. Give me a minute to get comfortable for show, and I'll be right with you. Let me back up. Okay. Tonight's information is end of life information and resources for caregivers. Okay, so when a loved one is nearing the end of their life, they have unique care needs, and their family members also have their own needs for information and support. Questions and concerns abound during this delicate time and should be discussed with the healthcare team as they arise. The following information can help answer some of the preliminary questions that many patients, family members, and caregivers have about end of life care and the dying. Second sheet, give me a minute, guys. Okay, how long is my loved one expected to live? In the case of terminal illness, patients and their family members often want to know what their life expectancy is. This is a difficult, if not impossible, question to answer. Doctors may be able to make an estimate based on what they know about the patient's health, but it is just an educated guess. Physicians may be hesitant to even provide an estimate out of fear of instilling false hope or destroying hope over and underestimates are very common. If your loved one is keen on receiving an approximation, remember that things can easily change. Avoid accepting what the doctor says as a definite timeline. If I am caring for my loved one at home, when should I call for professional help? It's likely that there'll be times when assistance is needed from your loved one's healthcare team. Contact their doctor, nurse, or hospice program for help in any of the following situations. Getting help if your loved one is in pain that is not relieved by the prescribed dose of pain medication shows discomfort such as grimacing or moaning, has trouble breathing or seems upset, is unable to urinate or empty their bowels. Has fallen, seems depressed or talks about committing suicide, has difficulty swallowing medications or refuses to take medication. In addition, family members should call for help at any time they are feeling overwhelmed. If you are physically exhausted, too grieved to or afraid to be with your loved one, you are unsure how to handle a situation, do not hesitate to contact the care team. That is exactly what they are there to help you with. Okay, what are the signs that death is approaching? Certain signs and symptoms can help you anticipate when death is near. They are described below, along with suggestions for managing them. It's important to remember that not every patient experiences each of these symptoms, and that the presence of one or more of those does not necessarily indicate that a person is close to death. A member of your loved one's healthcare team can give you more information about what to expect. Okay. Give me 1 second, guys. Be right with you. Drowsiness, increased sleep, and or unresponsiveness. These symptoms are caused by changes in metabolism. If possible, it is best to plan visits and activities for times when your loved one is alert. It's important to speak clearly to them and talk as if they can hear directly to them and talk as if they can hear, even if they are not responsive. Most patients are still able to hear even after they can no longer speak. Do not attempt to shake or arouse your loved one if they do not respond. Confusion, restlessness, and aggression, and or visions. Your loved one may be confused about the time, their surroundings, and or identity. of their family members. This can cause them to become restless and anxious. Hallucinations of people who are not present may also occur in some patients. Gently remind them of the time, date, and people who are with them. If your loved one becomes agitated, do not attempt to restrain them. Be calm and reassuring. If their anxiety increases, contact their health care team for guidance. Decrease socialization and withdrawal. This can be caused by decreased blood flow and oxygen to the brain and mental preparation for death. Speak to your loved one directly and let them know you are there for them. They may be aware and able to hear but unable to respond. Professionals advise that giving permission for them to let go can be helpful. Reduction in or loss of appetite or thirst. At the end of life, the body needs to conserve energy. Certain processes, such as digestion, will slow and eventually stop. Allow your loved one to choose if and when to eat or drink. Ice chips and sips of water or juice may be refreshing if they can swallow. Make sure to keep their mouth and lips moist with products such as glycerin swabs and lip balm. Loss of bladder or bowel control. Keep your loved one clean, dry, and comfortable as possible. Place disposable pads on the bed beneath them and remove them when they become soiled. Their healthcare team will instruct you on the best products and techniques to use. Darkened urine or decreased urination. This is caused by decreased fluid intake and reduced kidney function in some cases. A catheter may be appropriate for preventing blockages. A member of your loved one's healthcare team can provide instructions on how to take care of the catheter if one is needed. Cool and or discolored skin. Your loved one's skin may become bluish in color, especially on the underside of the body and extremities. This is caused by decreased circulation. Although their skin may be cool to the touch, they may not actually feel cold. Blankets can be used for warmth, but avoid using electric blankets or heating pads, which can cause burns, irregular breathing patterns, and or new sounds while breathing. Changes in breathing are very common. Your loved one's breathing may become shallow, alternate between rapid or slow, and be accompanied by rattling or gurgling sounds. They may be able to breathe easier when lying on their side with pillows placed beneath their head and behind their back. Although labored breathing can sound very distressing, gurgling and give me 1 second, guys. Get paper. Rattling sounds do not cause discomfort to the patient. An external source of oxygen may benefit some patients. If your loved one is able to swallow ice chips, may also help a cool mist humidifier may provide added comfort as well. Changes in vision. Your loved one may turn their head directly toward a light source due to a decrease in eyesight, trying to leave soft indirect lights on in their room to avoid glare and help them see. Increased difficulty controlling pain. It's important to provide pain medications as your loved one's doctor has prescribed. Be sure to contact the doctor if the prescribed dose does not seem effective. The healthcare team can also suggest other methods of pain management, such as massage and relaxation techniques, other physical changes, involuntary movements called myoclonitis, changes in heart rate, and loss of reflexes in the legs and arms are additional signs that the end of life is near. How can caregivers provide emotional support to dying loved ones? Each person has different needs, but some emotions are common during this time. These include fear of abandonment and fear of being a burden. Your loved one may also have concerns about loss of dignity. And loss of control. Caregivers can provide comfort in some of the following ways. Keep them company, talk, watch movies, read aloud, or just be with them, allowing them to express their fears and concerns about dying, such as leaving family, friends behind. Be prepared to listen. On the other hand, be respectful if your loved one does not wish to discuss these things or seem talkative. Follow their lead. Be willing to reminisce about their life. Avoid withholding difficult information. Most patients prefer to be included in discussions about issues that concern their care. All right, next page. Reassure them that you will honor the arrangements they have made and the preferences they have documented, including advance directives, burial wishes, etc. Ask them if there is anything you can do for them. Respect their need for privacy. Okay, then, what is the signs that a person has died? There is no breathing or pulse. The eyes do not move or blink. The pupils are dilated, enlarged. Eyelids may slightly open. The jaw is relaxed and the mouth is slightly open. Okay. The body releases bowel and bladder contents. Oh boy. The patient does not respond to being touched or spoken to. Okay, what needs to be done after my loved one has died? Okay, after they have passed away, there is no need to hurry with arrangements, or you and other family members may wish to sit with them, talk, or pray. Take your time. When everyone is ready, the following steps can be taken. Place your loved one on their back with one pillow under their head. You may wish to close their eyes, put their dentures or other artificial parts in place. If your loved one if your loved one was receiving hospice care, follow the guidelines outlined by your provider. A hospice nurse will usually arrive to verify the patient is dead and help you through the next steps. Contact appropriate authorities in accordance with local regulations if your loved one requested not to be resuscitated through though a do not resuscitate order or DNR order or similar mechanism, make their wishes known. If local ordinances require that, you call 911 to be sure to tell the dispatch operator that your loved one has died, the death was expected, and that this is not an emergency. Okay. Getting down to the last pages. Contact your loved one's doctor and funeral home when your family are ready. Contact other family members, close friends, or clergy. End of life articles. End of life signs that death is near. Learning the signs of Learning the signs that death is near will help you prepare for this inevitable and ensure that your loved one gets the care they need. Manage end of life symptoms and remain comfortable. Okay, folks, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.